It's now time for our first panel, which is focused on lessons from the U.S. response to COVID-19 and where we go from here. It's a pleasure to introduce Joanne Keenan, editor-at-large of healthcare at Politico, who will moderate the panel. Joanne?
Thank you for having me. We have five guests, I guess, and we're going to talk about some of the collaboration that happened, what we can learn from it, some of the collaboration that didn't happen, some public-private partnerships. We all know that the United States had high rates of infection. We were not prepared for this pandemic. And we still have high rates of infection. We're still not prepared. So we are going to have a discussion about what we should be thinking about, lessons to take away. I want to just very quickly introduce the panelists because you can find out more about them online. You have their bios. Bonnie Maldonado is a Senior Associate Dean, Professor of Global Health and Infectious Diseases, Pediatrics, Epidemiology, and Population Health at Stanford Medicine. Andy Slavitt is the former advisor to the Biden administration and COVID response. You all saw his briefings, and he worked for Obama before that. Brad Smith is the former deputy director of the Domestic Policy Council in the prior administration. Sally Sussman is the executive vice president and chief corporate affairs officer at Pfizer. So we'll be talking about that very rapid development of the Pfizer vaccine, which was not as rapid as some of the hesitant people think it was. And Alex Tabarrok, I just asked him 5 minutes ago how to pronounce it, and I might have still gotten it wrong, but he can correct me. He's the Bartley J. Madden Chair in Economics at the Mercatus Center at George Mason University and a professor of economics. I want to just dive in because we don't have that much time and we have a lot of smart people with a lot of things to discuss. I want to just start with a lightning round, and I just want everybody to really quickly tell me one thing that when you think of what went wrong, that's what comes into your mind, and to tell the audience. It is also important, we're going to end up on a brighter note, and we will ask everybody for one thing that went right, but start right now with something wrong. I'm going to start with Bonnie.
Well, I think one of the most important things that we did wrong at the beginning of this pandemic is we did not take this virus seriously enough. We had warning at the end of 2019. We saw what was happening in China and we did not listen. We did some half-baked measures, but they were clearly not enough. So I would say that we started off on the wrong foot.
Underestimated what we were facing. Brad.
I think we're going to find that shutting down so many schools and moving to virtual learning in 2020 and 21 has a lot more cost than maybe we realized at the time. In Nashville, where I am, math scores went down 56% in the public schools year over year.
Right. Sally.
What we're doing here today, which is we failed to convene a collective national conversation and get all the players around the same table.
That was a difficult thing to do at the time. Alex.
The most consequential failure of the crisis was not getting testing up and running sooner. The CDC, botched their test, but it was more than a mistake. The CDC never had a plan for making testing widespread available in a big way to bring in the private firms.
We've written about that a lot. That was the cardinal sin. Andy.
Yeah, look, I'll give you one short term and one long term. The short term basis. The president just lied to the public when he knew that people were at risk last January, and we spent months in the dark when we could have been getting prepared. Over the longer term issue is, I think Americans are really, there's a question of whether or not we're willing to even undertake small sacrifices for one another and for the common good to prevent loss. And until we're willing to do that, science isn't going to rescue us from this.
So I just wanted to get everybody in the conversation because that's the best way to connect us on Zoom, I have learned. But let's go a little bit more in depth one at a time. I'm going to go to Bonnie. We have watched the science unfold in real time in a pretty remarkable way. You're an expert on infectious disease. What have we learned fast about the coronavirus, and what was most consequential in the early days? There was a lot we didn't know at the beginning.
Right.
Nothing.
Infectious disease epidemiologists are trained to look for outbreaks and trained to look for patterns. As you heard from John Barry, we have a lot of history to go back to look at. So I think one of the things that really saved us here is that we understood coronaviruses in general, and we saw that there had been two other variant coronaviruses pop up, SARS and MERS. So we started in that direction. The first thing we did right away was to try to understand the route of transmission, which one was most important and how to prevent that. And the most important thing, in addition to all the mitigation, was understanding the correlate of protection, because that's how the vaccine evolved.
Okay. And I should say that we are going to try to work in some audience questions if we have time, so you can be putting them in. And I'll either, if we have time at the end, or I'll work some of them in as we go through. Brad, you were in the White House. You were a top domestic policy aide. You actually have a pretty good bipartisan reputation. People felt that you were someone both sides could talk to. There was a huge amount of information coming in, some accurate, some inaccurate, and some blank, right? Some things we just didn't know, we couldn't know that fast. How did you cope with sort of that flood, and where did you not adapt fast enough as the knowledge base grew? Where were there some disconnects?
It was amazing how much the information was changing literally day by day and week by week. And especially when you think about that first spike that occurred in March or April, I mean, really nobody knew what was going to happen, when it was going to come down. The testing, you couldn't track the cases. CDC's data system couldn't support it. There was no reporting on PPE across the country. And so really in that first, 3 or 4 months, the biggest effort was getting everything set up, which, I know we all hoped would have been set up through CDC and ASPR and some of these efforts, but which in fact didn't really exist, to be able to track everything. And coming in and, we ended up building a new database around CDC to be able to track all of the case data. We had to build the ability to track PPE at the hospital level. And so really the first 3 or 4 months was a lot around, on one hand, getting better information so we could track day by day. I would say the other thing that was really important is, I don't think anyone really had an understanding of the supply chains and what was necessary. And it feels like forever ago, because all the PPE problems have more or less gone away now. But, literally when I was sent over to work on testing and went to the strategic national stockpile, there were, hundreds of thousands of swabs, not, hundreds of millions of swabs. And there were 15,000 ventilators. And, just the amount of supplies and the way that we had stockpiled was really not sufficient. And while I'm sure there were people in the government who knew that, that was not something that had fully bubbled up in the way it maybe, we hope it will in the future.
We were sort of still stockpiling for 9/11 rather than for a pandemic, right? I mean, we were still that's how the stockpile got revived. Sally, Operation Warp Speed, which was launched on May 15th of 2020. You had a very ambitious goal of getting millions of vaccine doses available by December 2020, and you achieved it. Can you give us some insight into what was going on behind the scenes at Pfizer, and what were some of the challenges that you did face that you can now tell us about that you maybe couldn't at the time? And if we ever have to do it again, and we probably will, what do you want people to understand has to be, what's the lesson for the next disaster?
Thanks. There's a lot of question in that question. Let me just start by saying I wish I could invite everyone to have come behind the scenes at Pfizer during those months, because they were the most extraordinary time in all of our careers to be working in this way. In early March, Albert Bourla, our CEO, declared he would do 3 things: take care of our 90,000 employees, can keep the continuous flow of necessary medicines around the world flowing. I mean, people still had cancer and all sorts of other terrible diseases during COVID, but that we would also bring forward a vaccine within the year. And, there were there was a ton of coverage of what was happening here. Of course, Politico is my go-to news source. But I think my favorite headline of all the coverage of this time was a Wall Street Journal headline, and the Wall Street Journal was embedded with us throughout the process, that said, the day after we announced our efficacy, the headline said, Pfizer's vaccine, crazy deadlines, and a pushy CEO. And this is a business school lesson for anybody attempting a moonshot, that what you really need to do is to set an impossible goal. I mean, it usually takes, as everybody on this call knows, 8, 10, 12 years to make a vaccine. If we'd said, well, we're going to do it in 9 years, we would have just amended our processes and tried to do what we do faster. But by crushing the time frame, it required an entire rethink and redo of how we worked. So things that happen typically in a linear fashion happen simultaneously. And the second half of that is the pushy CEO. You know, unlike the way corporations usually work, which has a lot of hierarchy, a lot of bureaucracy, everybody who worked on what we called Project Lightspeed met a couple of times a week, often daily, on a singular WebEx call with all parties at every level, from the senior most to the junior most, working on this project. And the project manager was Albert Bourla, because no one else had the ability to solve problems, resolve disputes, you know, move forward without the typical sort of politics or jockeying and positioning that often happens in big companies. So if in all the things I could say, those are the two most critical from a management leadership perspective that we had to do and that we did.
We're going to come back a little later to talk in a few minutes about some of the public perceptions about the speed, because that was sort of a mixed bag, right?
Yes.
But we'll come back to you on that. Andy, I know you could speak for an hour on the question I'm about to ask you, but you can't. Your book, Preventable, and also on the podcast you've been doing for many months, you've discussed the failings that predated COVID. And I've written about them too. And that has been many years of failures in our, you know, having a workable, reliable public health system. It's always been given short shrift, or when we finance it, then we back off 2 years later. So can you highlight a couple of the deficiencies, things that just weren't ready, and are we addressing them? And again, I know you could go on, just pick a couple and we'll come back. If we had more time, we can come back to some more. Data we've already heard about.
I'll actually skip over all the technical and tactical things about testing and stockpile, et cetera, because there's a reasonably straightforward. We know they were underfunded and they have to be funded more in the future. I think there's more that meets the eye, though, that I think is trickier. What is our attitude towards science and expertise when people who've studied virology and epidemiology their entire careers tell us this is what we need to do? Our attitudes, that is our medicine for a short period of time. And when we don't respond to that as other countries do, that puts us in a difficult position. We've got a healthcare system that when people lose their jobs, they lose access to healthcare at a time when people were losing their jobs on a massive basis during the pandemic, not able to take care of themselves. And then as Brad well knows, because he tries to solve these problems, the dollars in our healthcare system were sitting with insurance companies who didn't have to pay claims, and hospitals were running out of money, and they were the ones needing to treat people. So there were some lessons there. You know, the lives we lead, people who work for a salary and people who work by the hour, experience the pandemic very, very differently as the people in communities of color and so forth. These were all endemic issues. You know, the fact that kids, Brad brought up kids, the fact that kids had no school lunches and didn't have internet at home, that predated COVID-19. It reared itself up during COVID-19 as a problem, and it's going to be true after COVID-19 unless we address them. So we basically exposed a lot of kind of deeper sets of issues that are challenging to address, and we need to be able to have a dialogue as a country and even disagree politely, but try to resolve some of these things or at least talk about them.
Andy, I mean, one of the things that happens with public health is when it works, you don't see it. It prevented something. So then lawmakers, people who control the purse strings, think, well, we don't need that. I mean, how do we break that? Because when we have a crisis, we do invest in public health, and then we disinvest in public health. So is going through this horrible ordeal going to be enough that we'll have a longer memory? Because I personally don't think America has a very good memory.
Well, I think we need to start thinking about public health the way we think about other things like foreign intelligence gathering and foreign diplomacy. These are things we invest in. These aren't things, as President Trump said, where I don't like paying people to sit around and do nothing. So simply because it's not producing an immediate result, we all know doesn't mean that we as a nation shouldn't be investing in it. And look, I think there has been a talk track in this country for a couple decades, which has said that the greatest threat to our country, by far our greatest threat, is the budget deficit. And that's what's going to bring us down. And as it turned out, it wasn't the budget deficit that brought us down. It was the fact that we didn't invest in some basic fundamental principles, things that wealthy nations around the world have all invested in, and we haven't. So it's not to say that the budget deficit isn't important, but I think it belies the fact that if you don't invest in basic research, thank God we invested in the mRNA platform. Thank God we've invested in other things. There's some really good stories here too, but there are things we didn't invest in because we believed that cutting the public health workforce in half over the course of 12 years wouldn't have a consequence. You know, we know better now. So if we think of these the same way we think of investing in foreign intelligence and those sorts of things, we'll make more strategic investments.
Bonnie, you are an infectious disease expert, and you've spent your career looking at waves of diseases, ones we've conquered and ones that we have not. Do you want to comment on what Angie said? What comes to mind when you hear that?
Yeah, absolutely. So I did train many years ago at CDC, and I saw the value of that system, but I also saw that the value of the system was not really widespread across government and private sector levels. So I felt that moving out of that system was going to be how I was going to make an impact. But I absolutely agree that it's very hard to look and see how we have doubled our life expectancy in the last 100 years has not been the fancy or shiny bright objects. It's just gumshoe epidemiology. It's hard work that nobody sees. It's putting out the house on fire rather than looking around at other landscape distracting issues. So I think that really trying to listen to our infectious disease epidemiologists or whatever the issue at hand is, the public health sector, and supporting those people. It's not just infectious diseases, it's other things like occupational health, environmental health, all of those people who work behind the scenes and to trying to prove a negative, that is something is absent, and that's a good thing, has really been one of the keys. And I think our own best hope, I think, is, as you heard from Andy, is to really try to make sure that the congressional budget, the line items reflect that kind of investment that we don't really know if the public sees or not, but it does impact the way we can carry out not only short and medium term infrastructure support, but long term. Okay. So public health is critical, and it's multifaceted, and it doesn't happen overnight. And the other final area I'll point out is health disparities, which, as you know, as you heard, have always been there. But we do have an opportunity to shine a bright light on them now and to start to address them, because this is not the last time we'll have this kind of a scenario.
Yeah, I mean, if anyone didn't see the charts in yesterday's Washington Post, to remind you of the 1 out of 500 Americans, and when you look at the racial breakdowns, 1 out of 500 Americans have died. And when you look at the racial breakdowns, particularly among younger people, it's really, it is very stark. And it hasn't stopped. So that opened to another conversation. I know that there's going to be a whole panel on that topic in the series, but I think, thank you for bringing it up, because it is one of the challenges that we should have addressed decades ago, but need to address now. Alex, you're an economist, and you also are an expert on risk. You've talked about the scale of action needed when you have a crisis this big. Of course, we didn't realize how big it was at the beginning. Did we do enough? Did we, at the beginning, were we too timid? Did we grasp what we needed to grasp? And do we grasp it now? Where are we putting the energy and resources? We're 18, 19 months in.
Yeah, we just had the anniversary of the 9/11 attacks, 20th anniversary. And it's baffling to me, the different responses to the crisis. So with 9/11, within 2 weeks, we had special forces on the ground By October, we were bombing Afghanistan for good or better or worse. I'm not making that claim, but we were bombing Afghanistan within weeks. By December, we'd taken over the country, we'd routed the Taliban, we had Kabul and so forth, right? And yet when it came to fighting the virus, we did not act anywhere near as quickly or with as much material. The country was actually lethargic in many ways, as was the government. The virus has killed many, many, many more people than Al-Qaeda. There were weeks during the pandemic when there was a 9/11 every single day, day after day after day, and we weren't fighting the virus. Even now, we have spent much more, trillions fighting Al-Qaeda compared to what we have spent, fighting the virus, which is comparatively little. So even now, we should be investing a lot more in producing a nasal vaccine. We should be vaccinating the entire world, not just as a humanitarian gesture, but for foreign policy reasons, for reasons of our own self-interest. The FDA should have approved tests much, much earlier, rapid antigen tests. And look, I want to make just one more point and then I'll conclude, and that's this. Look, the pandemic, I'm actually not worried about a future pandemic in the sense we've seen one, we'll do better next time. But the pandemic was just one example of a small probability event, but very bad. And human beings, they don't like these, they're not good at dealing with these kinds of small probability, very big events. They put them off, they think they're zero, they don't do anything with them. So there's a whole class of these events which we need to be thinking a lot more about. For example, I'm actually worried, about a solar storm knocking out the electrical grid and the internet and literally putting us back into the dark ages for months at a time. That could happen, a Carrington type event. That's a real possibility. We need to be thinking about these kinds of very bad, low probability events and how to deal with them much more broadly.
So, I mean, what's the thing that we're not doing right now that worries you the most? Because we're still not totally getting how bad it is. I mean, portions of the country aren't, some states aren't. What do you, this long list of things that we still have to do to we're never going to conquer it completely, but to get it to a tolerable level, a manageable level.
Yeah, I mean, for example, just to give one example,
I don't want to start thinking about solar storms, but
right? No, I understand. But that's precisely the problem. You don't want to think about it, and other people don't want to think about it. So that's a good illustration of what I'm talking about. Though I understand what you mean. On things to do right now. Look, you can walk in Germany. You can walk into a supermarket. You can buy a rapid antigen test for less than $1. Yeah. But look, Trump should have done that. The FDA has delayed and delayed and delayed on these rapid antigen tests. We should have had 50 of them approved. I mean, the ironic thing, or not the crazy thing, is that in Germany, you can buy these rapid antigen tests, which are produced by American firms, right? But they're not available in the United States, but you can buy them in Germany. So my view is, if it's good enough for the Germans, it's good enough for me. And we need to have much, much more testing in the hands of the public. It's a 15-minute test. You do it yourself. You can, if you're fine, you go, and it tells you whether you're infectious or not. That would be very, very helpful. A nasal vaccine would be extremely helpful. So a lot of things about vaccine hesitancy is actually fear of needles. Right. And the needle kind of just says, like, this is serious medicine. We got to take this seriously. But in fact, the vaccine is much, much safer than many of the drugs you and I ordinarily take, routinely, like ibuprofen or something like that. So I think if we had a nasal vaccine or an oral vaccine, we'd get over a lot of vaccine hesitancy. So there's a lot of things we could still do today.
And also, just quickly with Bonnie, I mean, the whole idea of a nasal vaccine, and there are people looking at it. I don't know if Pfizer is, but I know there's scientists looking at it. It's also because the breakthrough infections, the rest of your body's protective. There's still a lot of virus in the nose. So the idea of, because again, we're still, as we go forward trying to fight this, since Alex brought it up, that would be to attack the virus where it's the launching pad for affecting others. And you would try to neutralize that launching pad if in fact the science works.
Yeah, absolutely. What you need to do is you need to diversify your portfolio of vaccines. It's never a good idea to put all your eggs in one basket. And looking at oral vaccines, looking at nasal vaccines, and looking at rapid antigen tests for that matter, none of them are perfect, but you can't let that stand in your way, because having something is better than having no way of understanding where you're going to go tomorrow, if you're going to be able to go back to work. If you have a nasal vaccine, for example, that doesn't really protect you very much, but it protects your neighbor from getting infected, why wouldn't you try that? The polio vaccine is an oral vaccine, and that's why we're on the brink of eradicating that disease. It took 30 years, but we also didn't invest a lot in that either. So again, we just need to diversify the portfolio and look at all options and not stop because there could be a glitch 20 steps down the road. Just keep working at it and see what falls out at the end of your first set of trials.
The country that has not eradicated polio, for a very brief digression, is Afghanistan. So I'm not really optimistic that that's imminent right now. But that's another topic. Andy, the vaccine resistance and the vaccine hesitancy, it sort of gets lumped into one conversation. And there are really two things. There's people who are anti-vax on ideological grounds. They're not going to have this vaccine for, they don't believe in the virus. We all know there's that group, the real vaccine resistors, the ideological ones, the court fights that we're going to be seeing, the resistance we've seen. There's another set of vaccine hesitant, and it has shrunk, but it is still there. And I think it gets lost sometimes in the conversation because we talk so much about the politics, and President Biden talked about that the other night too. Why is it still so hard? We've mentioned needle, the needle concern, the needle phobia, or the needle, people who really hate needles. But there's also, there's youngish people, not just really young, but, under 40-ish, low vaccination rates. We still have minority groups. We've got an equity team. Biden's put in very good people. There's a lot of outreach. I live in the Washington area. I've seen the efforts that have gone into the Black neighborhoods in Washington. It's still really, really low vaccination rate. We have and many of you watching see the same thing in your cities. We have a Black mayor who's gone, who's very pro-vaccine. We have a Black health commissioner in DC. We still have really, really high rates of hesitancy and we've had high rates of disease. What's it going to take? What don't we understand yet, or where have we failed there?
So, we did a lot of work on this from the start in the Biden administration, trying to really understand this, and our understanding, I think, was held pretty true, which is there's really, I think you're right, it's not a monolithic group. There's probably three groups I'd pay attention to here. The first is there are a number of people that still have questions, legitimate questions, concerns, and those people should not be lumped into people as being anti-vax. They have the rest of their vaccines, and what we know is that 2/3 of them believe one of 5 falsehoods about the vaccine, provable falsehoods, and so this is a lot of people are seeking their information on places like Facebook and WhatsApp. And I don't recommend that. Stanford would be a much better choice. So that is an ongoing battle to get people just reliable information and be patient, more patient than we want to be, et cetera. There's another large group of people that just actually don't care very much either way. Most of them are young. If you're 18 to 25 or even 18 to 30, less than half of people are vaccinated. And it's not because they have strong feelings. They just kind of feel like maybe they've had COVID, or maybe it's just inconvenient. But about 25 million people say, if I were required to do this in order to show up to work, go to a bar, go to a concert, I would do it. But they need a nudge. And this is where I think Biden's proposal over the last week, creating more requirements to do more things and be around more people, it'll be effective with those people. Yes, there's a smaller hardcore group of people that are anti-vaccine that are spreading misinformation. And at some level, nothing's going to work for many of those. A vaccine requirement is not going to work, but you can get to 85 to 90% of the public by, I think, working on the first couple sets of things. And I think those are the things we have to do. We're now last in the world of all democracies and industrialized nations. We're 45th of all countries in vaccination level. We were second behind Israel, or third behind England, and now we're 45th. And we're going to be last if we don't do something. We will be the place that is most vulnerable, the hotspot. We talk about we got to vaccinate the globe to protect us from variants. No, the globe needs to vaccinate us.
Right. I'm going to go to Sally in a second because we sort of come back to that speed question, but I want other people to sort of, I think the people who don't think it's necessary, particularly younger people, I think it brings in some of the themes some of you have raised. One, the speed, what we thought we knew changed. It wasn't that we were stupid. It wasn't that we were in understanding the virus. We thought certain things. Remember, we were all washing our mail. Remember, we thought it was all on surfaces. We were all, bathing in Purell. But one of the messages early on, and Brad might want to address this, and then Bonnie, we were told this isn't really a disease of young people. We were just told young people need to be careful because you don't want to infect your elders. But young people who already think I'm a mother. Young people already think that they're the young invincible. They don't worry about themselves the way we as parents worry about them. But they were also being told this not because anyone was lying, but because at that time, a year and a half ago, we didn't know that Delta was going to come and that young people would be filling our hospitals. So as Brad, I guess let me ask you, and then I'll go to Bonnie on this. You were not the person up there. Scientists were saying this was the message people were getting, but at some point along the line, we learned that was wrong, that young people did have to worry, that they were vectors, that they could get sick, that some of them would die, and obviously with Delta, it's worse. How in retrospect could that pivot have happened smoother, better, faster, more effectively? Brad?
I would say one of the things that was the hardest to do, and I think is still the hardest to do today, is there is so much uncertainty about what is going to happen and what we're going to learn in the future. And I think given where the country is from a partisan perspective, people getting their news from different sources, that level of uncertainty that's just a factual reality of the virus and how it evolves is incredibly difficult to communicate. And I think that makes it, as we learn things and as things change, people can pick out the pieces of that they want and take advantage of it. And when you talk about, for example, younger children and kind of what we've learned and how that's evolved, both as the virus has evolved and as our knowledge of it has evolved, right? On the one hand, we've learned that folks can, that more children are getting sick with Delta than before. On the other hand, the CDC said, we don't need 6 feet of space. We can now have 3 feet of space if we have other appropriate measures in schools, right? And those are complicated messages. And I think figuring out ways when this happens again to deliver those more complicated messages and for people to be able to understand the uncertainty that is inherent in these situations is important, because I think when people see other things changing that they don't understand, it makes them doubt and have more questions about what's true.
What about like the 20-30 somethings? Because they have the agency to get vaccinated now, and their rates are not high. I mean, this is probably I remember a quote talking to an epidemiologist 6 months ago or so in Florida, and she said, "Excuse me, we've got the bars open and the schools are closed, but not only do we have which is sort of in line with some of your concerns, but not only do we have the bars open, we had bars packed. Right? You'd see these pictures, and they were vectors. They did spread. So, is there something about the younger adults that needed to be messaged differently?
Look, I think early on, like a lot of the data suggested that younger folks weren't getting as sick. And over time, you've seen more of that, even in children most recently. But I think that was the reality of the situation. And I think as we've learned more about how it spreads and how it can spread through many of the settings that you just mentioned, I do think it requires that persuasion. And it's really, to Andy's point earlier, people have to make a sacrifice for other people, right? And whether we mandate that sacrifice, whether we try to persuade people of that sacrifice, there's different tactics that you can take that might have different effectivenesses to them. But I think that has become clear that that's, very important.
Bonnie, I mean, talk about, I mean, this has been really hard because the science has changed and the virus has changed. It's both, right? Where Delta is different than what we were dealing with in February and March of 2020, that the virus is different, but also what we know is different. And there's so many mixed messages and so much misinformation, and sometimes not misinformation, but scientific uncertainty, and different experts say different things in good faith. I mean, look at what's going on with the boosters right now. As we probably as we speak, they're fighting about this. So why, given that you have good uncertainty, and given that you have change, and that given science moves incrementally, but people want certainty, and in this case, we needed, even with uncertainty scientifically, we needed to protect ourselves and others. We needed actionable information. Where do you see, chinks in that communication armor and messaging? Like when you were at home watching officials in both administrations talking, what made you say, don't say that?
Yeah, well, so I work in vaccines for children mostly, and it's one thing when a parent sees their little 6-month-old child and imagines all of these things that can happen. It's a lot easier to convince that person that, oh yeah, the risk is low, but there's a risk for your child. They will jump on that by and large. I agree, there are 4 groups, I call it the 4 Ds: dissent, distrust, deliberation, and indifference. Those are the 4 Ds of vaccine hesitancy, and you have to address them all very differently. But in addition to that, this HIV is a precursor to what we're seeing. So we know that HIV was a fatal disease, and yet you can't stop people from having sex, right? That's not on the table. So how do you mitigate those behaviors? People don't see they don't believe they're going to be personally at risk for a lot of these things. And it's the same with COVID. And frankly, I'm a little surprised here because we always said every age group can get sick. It's just that some age groups are going to be more likely to be sicker than others. So it's a risk calculus that people are willing to take. We know every year we have a pandemic of flu that kills thousands of people in this country, and we don't think twice about it unless you're somebody like me who has to vaccinate people. So I think the issue really is about what is my long-term risk and my short-term risk. And most people, this is a clever virus. It makes most people, 80% of people don't have symptoms. So they figure, what the heck, I don't care. 20% risk is not a big deal to me. I think that's where we went wrong, is we need to make it clear, 20%, but think about your risk of getting sick, being hospitalized, being put on a ventilator, even if you're 30 years old, is more than your risk of being bitten by a shark or getting, hit by a car. So, translating that out in ways that people can understand and bringing it back down to the community level. You can't do it at a high level. It has to be brought down to the community. So yes, that high level messaging from our leaders is important, but bringing it into communities that people can understand, and social media is very good at that.
Okay, let me go back to Sally, because the warp speed was a double-edged sword, right? I mean, you had incredible speed, you got it done. And yet that speed, I mean, those of us who write articles about vaccine development know that you were working on this for years, know that some of the basic science was done in, back with SARS in 2003. The average person does not understand that. They think warp speed, fast, too. And for some people, it's too fast, it's dangerous, it's scary. They didn't test it. People do not understand how big these clinical trials were. People do not understand that they were actually quite extraordinary, that the warp speed was not the basic science, but the building the factories, the doing the big tests fast, all the stuff to get it from the bench where it had already been for a number of years, or a lot of them, I don't mean all of it, but a lot of it had been done. It wasn't rushed. And sort of that messaging, just where was that? How do you fix that?
Yeah, well, as you
what
said
was
earlier,
wrong in retrospect? It wasn't just Pfizer either. It was the vaccine world and the public health officials talking about the vaccine. I don't want to lay it on Pfizer. You didn't name it, but how did that hurt? What was the lesson there?
Yeah, a lot of lessons. I mean, I want to underscore something you said earlier, which is we didn't start thinking about this yesterday. Pfizer is a 171-year-old company. It's been making vaccines for decades, and has been working with our partner BioNTech on mRNA research for years. But the public didn't watch closely until the pandemic hit. And so we feared or knew early on, suspected that it would be tragic if we created this wonderful vaccine that people were afraid to take. And in the early days, there was quite a conflict between people fighting to get the vaccine and others refusing to take it. So there was a lot to wrap one's mind around. We took a couple of steps I thought were really key, like posting our clinical trial protocol on our website, really a level of transparency that had never been done before. We had Nat Geo come in and film us so that people could watch and see it as it was developed. I thought, oh my God, we're filming our failure if it doesn't work, but these were risks that we needed to take.
You forgot to invite
end,
Nicki Minaj.
There's that. And then I think just two other points, really. One is we never, as a society, should have ever let this become political. We know we have ideas, all of us, about how that happened, but we should have been bigger than that. And then lastly, I'd like to agree with Bonnie in what our research shows is it's not about celebrities, it's not about politicians. It's about the teacher, the preacher, the lady next door. And it is taking time, but those messages and messengers that are very sort of on the ground and neighborly is crucial.
Okay, I want to go through two sort of quick lightning rounds because we're running out of time. I want to talk a little about public-private partnerships, and then I did promise you that I would each let you say something if you can all think of something we did right. Some of you might not. Let's talk a little bit about where the public-private partnerships, and we've talked a lot about Pfizer, obviously. Where has industry helped? That is something that we should be building on the future. Not all of you might have an answer. I'm going to ask all of you. If you don't have much to say on this particular topic, we'll just move on. But let's keep this pretty quick. I'm going to end with Brad because I think he was creating some of that. But Bonnie, is there an area? I don't know how much this is relevant to your work at Stanford.
Oh, absolutely. I mean, I'm working with NIH, the FDA, CDC, and I have been for my whole career. It's how we get things done. It's the coin of the realm. And I think we have been able to figure out how to partner with not just this disease, obviously, but throughout other diseases. We have the know-how to get together and work. We just need financial support on both ends, and we need to make it a little more nimble. Getting contracts and grants out. Most of the early work was not done with federal funding because it takes a while to get that moving out the door. So actually just making it easier to get that process moving and working, I think would be really critical. But we did have those partnerships.
Sally, is there anything that you didn't bring up already that you want to add on public-private? Okay.
No, I can
Alex.
pass.
Okay. Alex, risk, thinking big, doing big, acting big. Where's the public part? What did the public-private partnerships, where did they fail? Or where do you think they did?
Yeah. No. So look, the American government failed very badly, particularly the FDA and the CDC. Really what succeeded to a large extent was the private sector, particularly the high-tech sector. So Amazon has been great. Zoom, which we're on now, has been great in allowing many of us, not all of us, but some of us to be able to work from home and so forth. It's sort of ironic that a big movement in Washington now is to regulate and hobble the sector, which allowed us to get through the pandemic. I think ironic actually is not the right word. Short-sighted might be a better word. I could even be more pointed, but I'll go with short-sighted. On a more pleasant note, I think what really worked is what I call the American model. And the American model is harnessing our tremendous private sector, the ingenuity and the incentives of our private sector, along with a federal government which does not regulate or legislate, but which enables the private sector. So buying the vaccines with advanced market commitments, that was a tremendous success. Operation Warp Speed was really the crown jewel of what I call the American model. It was tremendously successful. We should have done the same thing for masks. We should have done the same thing for testing. So it's the combination of the invisible hand and the visible hand. It's the federal government working with the private sector that is really the unique American response. And it worked very well, and we need to build on that in the future.
My dad was an economist, so he would have liked that invisible hand and visible hand combination, although he probably would have asked you about the can opener. Andy, I met you originally in a public-private, you came from private industry to come in to work with the government to fix healthcare.gov. That's when I met you back in 2013. What's your perspective now on the pandemic? I mean, you've been on both ends. You've come in and out. What was good? Where do we miss that opportunity in the pandemic?
Well, look, I mean, I think we're missing the most obvious public-private partnership, and I agree with some of what Alex said, but I don't agree with it entirely. The biggest success was the NIH funding of the mRNA platform over 2 decades, which with Moderna and the great work that Pfizer did with BioNTech. I mean, this is our tax dollars and the ingenuity of people in the NIH and BARDA. That there was a Moderna because of smart people in the federal government. I do think and I think when I came in, Moderna and Pfizer were fantastic partners, doing really, really hard things. Go produce twice as many vaccines this week as you did last week. By the way, don't lose a batch. By the way, none of it can be unsafe. By the way, we need to get it out to people. By the way, you have 40 other countries asking you the same thing at the same time. And so they were incredible partners and a great working relationship. I think Brad could probably echo this. The people, the career civil servants in the Department of Defense and in FDA and in CDC are overshadowed by a couple of very visible mistakes. And I think Alex throwing the entire FDA under the bus when they, in effect, I think, set up the right criteria to get the EUAs done. And the people there were embedded. Marx's team was embedded inside all of the major vaccine developers to shorten the cycle for getting these vaccines approved. It doesn't happen automatically that we get safe and effective vaccines without that ingenuity from the FDA. So yes, public stumbles, but I think there's a success story here. Democrat, Republican administration, private sector, public sector rallied together behind the scenes and got a lot done.
Okay, I need to wrap us up. Brad, I'm going to let you do the public-private question, and then give me your what we did right, and we'll just go right into that fast. Everybody needs to do this last one quickly. Brad, where was a public-private observation we needed more of, less of? You started out talking about data at the beginning, and then what we've talked a lot about failures. What do you look back and do see as working?
I agree with that. I think Operation Warp Speed was by far the biggest success, and that was a huge public-private partnership. And the only thing I'd add to public-private partnerships from the early days is there was no choice about how we could approach this. When we wanted to fly PPE out of Asia, many of the countries we couldn't land U.S. military aircraft in. The only people who could actually go and pick up supplies were FedEx and UPS. When we wanted to develop vaccines, the only people we could even potentially turn to were private sector companies. When we wanted to have nurse practitioners go into nursing homes to give the vaccine, the only people that you could turn to were the private companies. And that's how we've chosen to structure the economy in the US. And I think making sure that we can take advantage and leverage, like I think we have in this response, the public-private partnership is essential. And honestly, in the United States, the only way to do it.
That's also your what worked, is that particularly with Warp Speed. Okay, Bonnie, quickly, what worked?
Well, frankly, I think the science really drove all of this. It was the science that worked. Maybe the messaging didn't get out the way it should have. Maybe it wasn't funded the right way. Operationally, there were challenges, but science really drove how we responded to this pandemic, and we can learn from the science to do it better next time.
Sally, what worked?
The science, mRNA technology, the greatest medical advance in a century that's going to do wonderful things going forward.
Alex.
BARDA worked. Operation Warp Speed really was the single best thing about the pandemic. The internet worked. Zoom worked. Amazon worked. So the private sector, particularly the high-tech sector, really worked very well.
And Andy.
Yeah, look, I think let me hone in on Warp Speed. Peter Marks and a number of folks through career civil servants had a great plan to develop things quickly. The Trump administration listened to them and made smart bets. The US made a portfolio of bets on 10 vaccines, and that was a smart strategy. They ended up picking the right ones. We give credit to Brad and the team for essentially a smart portfolio strategy. we have, we have the capabilities. My in a nutshell, I think we do great at the hard sciences and we do bad at things people call the soft sciences. I wish we had all paid more attention during psychology, sociology, and humanities as much as we paid in biology, physics, and chemistry.
So I need to cut everybody, not cut you off, but I do need to end it on time. But thank you all. It was a really, we covered a lot of ground in an hour. So thank you all for participating. And I'm going to turn it back over to the dean.
Well, thank you very much, Joanne, and thank you to our panelists for that informative and provocative conversation. I hope this discussion helped to illuminate some of the key issues that we must contend with in both the short term and the long term.